that one, that's one of the reasons I stuck that one in there. And, darn it, did I point that out to you on there?
You should.
And that's why I put all the labels underneath, because I'm liable to ask that off of there. And there was a nice little picture that showed how the pericardium kind of attaches to the diaphragm. Because obviously the heart sits right on top of the diaphragm. So, look at that picture again, that's the main reason I stuck that in there.
Right atrium.
Okay, right atrium, so, I mean, we wish we had a larger heart to show you here, but this is gonna have to do. And so, take the front off, and we're looking at, well, this isn't a bad heart model for its size. So this is right atrium, okay, right there.
Superior vena cava.
The which?
Superior vena cava.
Superior vena cava is, of course, drains blood into the right atrium.
All right.
Inferior vena cava.
Inferior vena cava, and of course you can show all those. Over here, we should go back and, okay,
I gotta go to the other side.
and so. Now then I'm cheating the people over there.
Sorry.
Superior vena cava right here. Okay. As well.
Inferior vena cava.
Inferior vena cava doesn't show up on that, but it certainly does on here, so let's see. Coming out the bottom. That's about the only place we have that. Yeah.
Right ventricle.
Okay, and we have right ventricle. So the blood comes back from all parts of the body and falls in through there.
Your hand's in the way.
Okay, oh.
Thank you.
Okay.
Okay. Tricuspid valve.
Okay, the tricuspid valve is the valve that I'm putting my little tool through right now.
Pulmonary semilunar valve.
Pulmonary semilunar valve, so then it pumps, once the right ventricle contracts, the blood is forced up against the pulmonary semilunar valve, and the cusps of that valve are pointing upward, as we said, and blood is forced out into the pulmonary trunk. And as I said, the pulmonary trunk is just about the most anterior part of the heart. This feature right here is the pulmonary trunk, okay, which bifurcates into the left and right pulmonary arteries. The right pulmonary artery goes underneath the arch of the aorta. Okay, so take this back off again.
And where's the right pulmonary artery?
Okay, the right pulmonary artery goes underneath the aortic arch. The left pulmonary artery is right here. And you can look up here, can you really see? Yeah. So this is pulmonary trunk. Left pulmonary artery goes to the left lung. The right pulmonary artery goes underneath the arch.
Left atrium.
Okay, the left atrium is up in here. And you see, if I turn the heart around now, and if we look at it from the back side, so bear in mind I'm turning it around, you can see these pulmonary veins coming back from the lung, and they're shown in red because they're carry oxygenated blood coming back from the lung, and they all empty into the left atrium. And so the blood comes in the left atrium and falls through the bicuspid valve or mitral valve. Okay, this is the valve you don't want to leak, and falls into this ventricle. Okay.
Left ventricle.
Okay, so this is the major pump of the heart that pumps blood out to the entire body.
Chordae tendineae.
And of course, we see the chordae tendineae, which attach to the papillary muscles there.
Systemic aorta.
The systemic aorta, what we're going to do is we're going to talk about the parts of the aorta. I doubt that I will, like I said, there's only, people don't just say the word aorta in an anatomy class. We say ascending aorta, aortic arch, descending aorta, and right here is the root of the aorta where it attaches to the heart. A lot of people have pathology with that attachment. It starts to become unattached, which is not too cool. And so anyway, as you come around the back side and as you pass the root of the aorta, the name changes from descending aorta to thoracic aorta. Get my drift? As you come around the back side. When you pass the level of the root of the aorta, it's no longer descending aorta, it is thoracic aorta.
Aortic semilunar valve?
Okay, the aortic semilunar valve is the valve through which the blood is pumped. So the left ventricle contracts and this valve snaps shut, the mitral valve snaps shut, doesn't leak, and the blood is forced out through the aortic semilunar valve into the ascending aorta, where it's pumped all parts of the body. Okay.
Interventricular septum?
Okay, interventricular septum is very clearly seen as the wall between the two ventricles. We won't do interatrial septum. I mean, maybe you can sort of see it, maybe you can't. I don't know, I don't like it.
Right coronary artery?
Okay, so you can see with this front part of the heart off, you can see the two coronary arteries coming right off the ascending aorta. That's the right coronary artery, and there you see the left coronary artery. Okay, the heart feeds itself first. It's the first vessels to come off of the aorta. Okay, and so then I'll put the front back on, and those vessels give rise to all these arteries all over the heart that feed the heart tissue. And you know what happens when a person has a heart attack. 91% of the time, it's because the blood flow gets shut off in one of these major arteries, coronary arteries of the heart. So,
Posterior interventricular.
and the tissue downstream dies. Yeah, so go ahead.
Posterior interventricular artery?
Okay, so the posterior interventricular artery, gee, I wonder if we got to that one. So, you mind if I do them in the order that,
I'm just doing them in the order on the.
I know, yeah.
Uh-huh.
Yeah, you're, like I told you to. But, right here in front of us, is the anterior interventricular artery. And that's one of the prominent features as you look at the heart, pulmonary trunk, anterior interventricular artery. Then over here we have the right coronary artery, which goes around here, gives off the marginal artery right there as you go. It gets its name because it's right at the margin between the front side and the back side of the heart. And then it keeps going around the back side of the heart and gives rise to the posterior interventricular artery, which is the one you said. So I sort of wanted to go through the whole thing as to how we got there. Okay, so then that's posterior interventricular artery. Then going back around here, and all that is branching off the right coronary artery. Then, as I said, the left coronary artery gives rise to the anterior interventricular artery. And what you can't see underneath here, but what is happening is that there's a bifurcation. The left coronary artery is really quite short, and it bifurcates, giving way to the anterior interventricular and the circumflex coronary artery. Circumflex means it goes around. So it goes around the back side to the left. So two major branches off the left coronary artery, the anterior interventricular artery and the circumflex coronary artery. And very often people have heart attacks they don't even know about because some little teensy artery will be blocked. And the effects of those little heart attacks can add up if you have them over a period of time, because every time you have one of those, the tissue downstream dies from the blockage, and you lose that tissue, and it fills in with scar tissue, and so you're losing cardiac muscle. Pretty soon the heart can contract with as much force as it did before, and you start to lose cardiac output. And that's why they made, primary reason they had you do a stress test is just because they can measure cardiac ejection fraction, which is what percent under stress the left ventricle should eject about 85% of its contents. And if it's ejecting 25% of its contents, you know you got a real problem, you know. So,
Apex,
the apex is the tip.
and then we're going to the cardiac veins.
Okay, cardiac vein is just all this big blue vein there.
Coronary sinus,
Coronary sinus is sort of a little swollen little chamber that empties in some hearts. If you get lucky and you start poking into the right atrium, you can find the opening into the coronary sinus. Because the coronary sinus drains into the right atrium, which is right over here. The right atrium is where all the returning blood from all parts of the body goes, isn't it? So the blood that is returning from the heart ought to go there too, and it does, through the coronary sinus. And a sinus is just sort of a wide spot where stuff collects. Okay.
so now we're going to brachiocephalic artery.
Okay, brachiocephalic artery. So, but we don't just, oh yeah, okay, brachiocephalic trunk is what I like to call it. And no right or left like they did in that one picture, because there's only one of them. So these are the three branches you can see if you use your imagination. Okay, we could do them off here too. I've been known to ask them off here. So just looking at this, how do I know this is the front side of the heart? Because that's the pulmonary trunk. Okay, and so we have the three vessels coming off the aortic arch. The largest one is the brachiocephalic trunk, and it is on the right side. Okay, and then we have the left common carotid artery and the left subclavian artery. Okay.
So then let's do the right subclavian artery.
Okay, so then the brachiocephalic trunk bifurcates further into the right common carotid artery, and what you can't see underneath here is the right subclavian artery. Okay? Maybe it would show on the other model, I don't know. Other torso over there.
It doesn't,
Yeah.
it's only basically, ascending aorta,
Okay, so we have the various parts of the aorta, the ascending aorta, the aortic arch, or the arch of the aorta, the descending aorta, and when you get past the level of the root of the aorta, about right there, it changes from descending aorta into thoracic aorta. So this is, can I see thoracic aorta on that model? No, can't. Can I see abdominal aorta? Yeah. And remember in that cadaver picture where it was just coming out through the hole, the root of the diaphragm goes down pretty low before it attaches to the spine. You see how the diaphragm is kind of like a double dome there? And the root of the diaphragm comes down pretty low before the aorta finally comes out. And that cadaver slice was right in here, right about that level right there, I think. And we were seeing abdominal aorta just as it came out of the diaphragm in that picture.
the right and left brachiocephalic veins,
Okay, the right brachiocephalic vein and the left brachiocephalic vein.
internal jugular vein,
The internal, there's the right internal jugular vein and the left internal jugular vein.
the external jugular vein,
The external jugular vein is on the surface of the sternocleidomastoid. We see it shown there.
subclavian vein,
Okay, there's the right subclavian vein and the left subclavian vein.
azygos vein,
The azygos vein is not shown on the model, but I have it on medical images, and those cadaver, that one cadaver picture showed it really, with the hemiazygos and the azygos. Notice that azygos is spelled with an O-S, not an O-U-S.
intercostal veins,
Intercostal veins, I don't think I have any, well, I might have some on that chest plate, but I
Yeah,
kind
you
of
do.
doubt it.
You do.
Do they show up? We can look, you might, well, maybe we should look now, I guess.
I think maybe I'm thinking, maybe I was thinking just the vessel.
No dice?
No.
Okay.
Um,
So intercostal means between the ribs, so, in between every set of ribs, there's gonna be a vein and an artery, all the way down.
Azygos arch,
The azygos arch is where that azygos system comes over and connects with the superior vena cava. Not shown on any model, but shown up nicely on a couple of medical images. That one MRI, which you have.
left common carotid artery,
Okay, left common carotid artery. Okay.
carotid sinus,
Okay, the carotid sinus is a little swollen place that right where the common carotid artery bifurcates, okay? And it has physiological significance just because there are all kinds of sensors located there, pressure sensors and oxygen sensors that sense blood oxygen content. There's a little swollen place right at the bifurcation of the common carotid artery. That artery bifurcates right about chin level. So right about here is where your carotid arteries are bifurcating. And you have the internal carotid artery, which is going unbranched up into the carotid sinus of the cranium, carrying 2/3 of the blood supply to the brain. And you have the external carotid artery, which gives off 7 named branches that we will learn.
superior thyroid artery,
So this is the superior thyroid artery.
lingual artery,
That's the lingual artery right there. The lingual artery goes deep.
facial artery,
The facial artery, on the other hand, is superficial. So you can't show it on that cutaway, but it shows up nicely. See how it comes around the edge? See, we're seeing common carotid inside there. This is facial artery right here. Very nice facial artery. Okay, it's quite a superficial artery. The lingual artery runs deep.
okay, superficial temporal artery,
And a superficial temporal artery is one of the 2 terminal branches.
maxillary artery,
Maxillary artery is the one that I can't find. As much as I use my imagination, I can't find it on this model.
axillary artery,
Okay, so, but we have other ones that aren't mentioned in the lab. We have the posterior auricular artery. Okay, and back in here, we have the ascending pharyngeal artery back in there, which are mentioned on the PowerPoint presentation, and that I want you to know all 7 branches. Maxillary artery isn't shown anywhere though. So we have posterior auricular, goes up behind the ear, sometimes called the occipital artery, and the ascending pharyngeal artery, and somewhere back in there is the maxillary artery that goes way in deep and gives rise to 15 named vessels, a lot of which are fairly important.
subscapularis artery,
Okay, subscapularis artery is right here.
brachial artery,
Brachial artery, okay, this is the axillary artery. Okay, the subclavian passes, what is really short, it passes, goes about right there and angles downward, and the moment it starts angling downward, it changes to axillary. And as it comes out here, it's axillary, and remember the teres major muscle? Okay, as it passes, as it goes past the teres major muscle, the name changes to brachial. Okay. So in here, it's brachial. Sometimes they'll do an angiography if you've really used up your femoral artery in your groin, because you've done so many angiographies that you've totally messed up your femoral artery on both sides and can't use it anymore. They will go in and put a catheter in the brachial artery, but it's much smaller. It's harder to do. And it then trifurcates into the superior ulnar collateral. Well, actually, it doesn't trifurcate. We have the superior ulnar collateral artery taking off to the side here, which provides collateral flow in case there's any blockage of this one. This is a continuation of the brachial, really. And the brachial doesn't truly trifurcate like it says in the lab. It's just that I really like that word. But it gives rise to eventually the radial artery, which goes to the thumb, the median artery, and the ulnar artery.
Radial palmar superficialis.
Okay,
artery.
remember we said we were gonna change the name of that, radialis palmaris superficialis, and goes around here, and the ramus carpius dorsalis goes around there, giving rise to several little metacarpia dorsalis, and we're talking about the dorsal side of the hand, dorsalis. And then you have arcus palmaris superficialis, which is very important because it provides collateral flow to the hand. So if one of these arteries should become occluded, you still have collateral flow to the entire hand. And remember, you and I were talking about, you were asking me about arteries that they use for bypass grafts. And the ulnar artery, if they test the patency, in other words, they check to make sure the artery's open and working and it's all good. If you have both of these exhibit 100% patency, you can use one of them. The one they usually use is the ulnar in a bypass graft because you still have collateral flow out to all the structures in the hand. They also, there's one in the chest region called the mammillary artery that they often use. But they've started using arteries for bypass grafts instead of veins because they hold up longer and they're getting so good at the procedure that people live for a long, long time. If you're gonna get a bypass, you should get as many done at once as you can, so you don't have to do it again. So it's rather invasive, to say the least.
Palmar digital arteries,
Okay, palmar digital arteries.
basilic vein,
Oh, and there's the basilic and cephalic and median cubital veins, which I can only show you on a picture.
and that's it.
Okay.
Where was the ramus carpius?
Ramus carpius dorsalis, the radial artery bifurcates into the ramus carpius dorsalis and the radialis palmaris superficialis.
Okay.
And those are kind of hard to remember.
So we have this test on.
So we'll have this test in 2 weeks. And be sure to look, I posted the new, the re-revised PowerPoint Lab 5 so that you have those cadaver pictures to look at. 'Cause I'll almost certainly use those in the future because I really like them. Okay, so.
It's a lecture test on Wednesday, right?
Yeah, and so Wednesday when we come in here and pretend like it's lecture. And then we do a lecture on the heart. A rather prodigious lecture, everything you ever wanted to know about the heart and interpreting EKGs and the whole ball of wax. So,
So
good
can I,
stuff.
Is cardiac muscle much different than skeletal muscle?
Yeah, it has gap junctions. It has many similarities